So I think the most important thing for patients is education in general. They want to hear from reliable sources what is a specific disease and what are the ways that we do to diagnose them, but also to treat them. And I think that patients are looking mostly to understand what they can do better, or if they have additional options that they were not told or they were not aware about. And I think the topics could be broad, but autoimmune diseases in general are hard to understand. And I try to focus my channel on a few of them. I'm very passionate about rheumatoid arthritis, and that's why you see a lot of information about that. I am passionate about Sjogren's disease, and that's why you have a lot of information about this. But I also try to publish from other diseases, different types of content. Patients are also interested to learn about alternative ways to treat. They think, combining integrative medicine with the traditional medicine is something that sparks their interest. And that's why I do combine the topics and I give them lifestyle interventions, and I talk about everything from mindfulness to nutrition to exercise, and also about supplements. Nutrition, supplements, exercises, and then information about treatments. I'm trying to make the most scientific, valuable information very digestible. So although I say something could be helpful, I always base um, my sayings on the science that is available today. They do help my own patients because they go back and review the information that is discussed during the consultations. And I don't know if you know about this, but apparently scientifically proven from a conversation that you have with a patient, at the end of that conversation, about 50% of that conversation is lost. And then 25% from what is remaining is taken wrong. So going back and reviewing the information that a physician was able to communicate with you, it's extremely helpful for patients. Yes, a lot of patients, when they come to me, they come with the expectation that they have to take tons of supplements. And the content of my channel proves that there is only some supplements that could be helpful and not all of them. Not everything that is sold to you is valuable. So a lot of people are writing comments that they change the way that they look at supplement, and they don't only think about taking something that just because it's written that is natural, they really need to take that because there is no scientific value into that. And I do have patients that they felt worse on taking many things that were not helpful. And that changed when we addressed those and we eliminated the substances, actually, because those are also substances that they put in their body. I think it's huge. The role is huge. And I think that the more of us that we are out there and we educate the public from our perspective as experts into autoimmune diseases, because we don't only talk about things, we also diagnose patients, we also treat patients, we also follow up patients for many years. So we have a very comprehensive understanding of what an autoimmune disease is. So I think that taking education from reliable sources and education from people that not only have the interest to sell you something is the most valuable thing that you can do to improve your outcome for any disease. Autoimmune diseases are chronic diseases, and they do require a specific focus, a specific attention, and they do require expertise. So it's incredibly important to know what to expect, what are your options, and if you try to bridge the Western medicine with the traditional, or the basically to bridge the Western medicine with the integrative medicine or lifestyle approaches or supplements, you have to do it in the right approach and not based on what your neighbor said or your friend said, because not everything that works for them will be applicable to you.